Pompey Sridhar is the India Director of MSD for Mothers that aims to standardize maternal quality care in private sector facilities across India, ensuring women receive quality care throughout their pregnancy and childbirth. She is a health and management graduate and Chevening scholar from London School of Economics with a passion about quality and affordable care. We have with us Ms. Paromita Banerjee, a black coffee drinking social activist forever pushing boundaries for a gender just world free from inequalities and hierarchies. She opted out of academics to chase this dream, won a MacArthur Fellowship for Leadership Development to start an experiment, and evolved as a social entrepreneur to become an Ashoka Fellow. She continues to learn from the young as the founder and the chief functionary of Diksha. It's a pleasure to welcome Dr. Debashish Bhattacharya, a surgeon by training, an entrepreneur by temperament, and a leading human risk management at Reckitt UK, strategic advisor of iCure with an in-depth passion for art and culture, the founder of Indian Arts. We also welcome Ms. Preetha Chakravarti, founder of Freecontour, a social enterprise that creates impact through stories mediated by Kathakars. She is also an award-winning filmmaker. We must all have heard grandma stories, and we always wanted to hear it from them. Why this is so? Because more than the katha is the kathakars that makes the difference in that story. So we would hear more from you. To start with Pompey, according to you, what do you see the challenges of care delivery model and how primary health care can step in to fill this gap?
Thanks, Tirumala. I personally feel that women, in particular, neglect their own healthcare. However, if the woman is educated, and that will happen if she receives good quality healthcare at every step, and there is never, a time which is too late to start. At any point, a woman is touching the healthcare system. If she is educated and if she gets quality health care, she will go back to her house and she's going to educate her family. And that's one of the reasons why Merck has invested in a maternal health program where we have no products for combating maternal mortality per se. We believe that women empowered with health knowledge can be those agents of change that can create that lasting impact on our communities. And it's extremely important to have women's voices heard at every step, that she is seeking healthcare, that she has, whether it's been a positive experience or a negative experience, and to be able to, ensure that the community steps up and that she has those support systems next time around, that she's going to touch the health system again. And I think this itself is it's fairly complex when it comes to deliver, but primary care in particular, I think is required at every doorstep. And in rural India, when I was part of the National Universal Health Coverage Program, and I was anchoring all the programs around primary health care, we saw that women did not travel more than 5 kilometers. Men would travel, even if they had serious illnesses or they had mild illnesses, they would still travel across. If they had insurance, no insurance, family would get, the money and they would travel across. But women very often were left to fend for themselves. And I think that definitely needs to change. And the government is promoting that by ensuring that we have these health and wellness centers. But how effective are they? And I think that's where the voices from the communities are important. It's also very important to partner with the government for the government to achieve their goals and to kind of make that case for philanthropy and for private sector where the government is falling short.
So I would go to Dr. Debashish with the question, as we just heard, how effective are they? So as a medical practitioner and an advisor, how do you see the healthcare system evolve through this pandemic crisis, and how women as frontline health workers can play the key agent?
Hello, everybody. It's a pleasure to be in this unconference, Sujoy's Dream Unconference, and I'm delighted to be a part of this team. The first thing is we need to radically rethink our healthcare process. Our healthcare process is actually based on a very Western concept. Our education, the medical education, is also based on a very Western principles. And now, with the amount of data that we generate every day, we should dig deep into this data, interpret this data, and use it to develop our own indigenous health system. Let us say hypertension. All the research of hypertension is done in Boston, in the Framingham Heart Study, which you probably know a lot about, London, New York. But we now have a lot of data from the Sundarbans. How do we know that the protocol that is developed for the Western world is actually applicable in India? So we really need to dig deep. We can keep the framework of the Western medical system right, because the Western medical system is the American system, the British system is made for Britain and America, where the patient is completely different. Rural India is different from urban India. So my suggestion would be, especially, I think this is something that we could take up in a very big way, where we analyze all the data, we put our resources, and we should actually work towards develop our own indigenous system. So I think the first thing that we should do is look deep. The health by itself is important, but I think more important are the social determinants of health, which actually means housing, income, which means connectivity. And this is completely different. Like when we were analyzing data for the McGill University, you'll remember, the data scientists would discard the data as dirty data. That is not dirty data. That is actually speaking volumes about the socio-economic background from where the patient comes. So what we need to do, we need to strengthen the socio-economic background by a holistic method, and then the growth will be inclusive. So health, the medicine is just a part of the solution. We have to look at the bigger picture and form a bigger solution. Thank you very much.
Thank you. So we would go back to Ms. Paramita. So how do you see that we can improve access to sexual and reproductive health and rights?
Okay. Thank you, Tirumala, and thank you, everybody. And with everybody's permission, I'm going to mix my language. I was just thinking that if this unconference was happening in French, I would have probably walked out of it by now. So I'm going to mix my language. Please allow me that. দিদি আমি বলছি যে আপনারা এখনো বসে আছেন, তো আমি বাংলাতেও বলার চেষ্টা করব যাতে আমার কথা আপনাদের কাছে পৌঁছায়। Sexual and reproductive health and rights. I think even in 2023, these are taboo words. In much of India, the Sundarbans included, much of rural India for sure, you certainly do not utter the word sex. And the stereotypical idea that if children learn about sexual health, then they're going to behave in an unruly manner, become sexually active, is still very strongly entrenched. I mean, in reality, it's the exact opposite. দিদি এখানে যদি আমি ভুল বলি আপনারা আমাকে একটু কারেক্ট করবেন। আমি বলছি যে যৌন স্বাস্থ্য, কেন মাসিক হয়, কিভাবে বাচ্চা হয়, এইগুলো ছোটদের শেখানো দরকার, কিন্তু আমরা এগুলো শেখাই না। আমরা এগুলো নিয়ে কথা বলতে লজ্জা পাই, যেটার ফলে গন্ডগোল হয়। আসলে ছোটরা যদি শিখতো তাহলে ভালোই হতো। And so there are several very, very important indicators that are on the negative. I tried my level best, but I couldn't find block-specific data. But I was just looking at the NFHS 5 data, the latest family household health survey data that is done by the government. So I was looking at this district, and there is 53.7% underage marriage in the district. And of course, you were talking about social factors. Of course, social factors are a huge issue. মেয়েদের অল্প বয়সে বিয়ে, I was just talking, আপনারা আমাকে একটু আগে বলছিলেন অনেক কমে গেছে. I was talking with them before we started speaking, and then they said that cycles and Kanyashri is actually helping girls to stay in school. If that be so, it is good. But it is social factors, yes. But it is also a lack of understanding about sexual and reproductive health and rights, as also the whole, consent. I don't think the idea of consent even exists among our adolescents. So I would like to come in. You're talking about holistic development. So with all the social factors that you have already mentioned, I think two things need to be built into that approach. Number one, gender. I know it sounds like a hackneyed word, but it's not hackneyed. It's still very, very relevant. Gender bias determines the choices women can make or cannot make. মেয়েরা কি সিদ্ধান্ত নেবেন না নেবেন সেটার অধিকার এখনো মেয়েদের হাতে পুরোপুরি পৌঁছয়নি। তাই আমরা মেয়েদের স্বাস্থ্য নিয়ে কথা বলতে গেলে যেন মেয়েদের কথাটা শুনি, আমি এইটা বলতে চাইছি, মেয়েদের স্বাস্থ্য নিয়ে তাদের জানা আগে দরকার, যেটাও আমরা সবসময় জানাই না। So number one, the idea of consent, the immense importance of women having a right over their bodies and over their reproductive decisions, neither of which is even thought of seriously. And three, this just the simple knowledge that the woman, the mother, has nothing to do in the production of a boy or a girl. The Y chromosome has to come from the father. It's a simple thing. But believe me, because I work at the field level with communities, if these simple things can be communicated to adolescents, then gender perceptions change in adolescence. They start looking at each other differently. At least this constant blaming of the mother for producing girl children, and okay, so there is domestic violence, but that's obviously connected with larger health issues and with reproductive and sexual health, because the mother will be forced to conceive until she can produce a son. It's a very, very common reality. In much of India, even much of urban India, definitely in rural India, including rural Bengal. দিদি, ছেলে হওয়ার আগে অবধি বাচ্চা হওয়া বন্ধ করা যাবে না, এটা তো আছে এখনো। এটা আপনারা হ্যাঁ বা না বলুন, আমি জানতে চাইছি। আছে কি? নেই? মেয়ে হলেও বন্ধ করা যায়? Okay, so they're saying that it's reducing. I was asking them if this son preference has reduced. They are saying it has reduced. If that be so, well and good. I'm sorry, forgive my saying so, but I think it's a politically correct answer because my field experience does not agree with that. So, beginning, and our school system will not address sexual education. That's clear. That chapter you're always asked to read at home. So, for organizations like iCure, when you're coming in with health system, you're collaborating with them to capture their experiences and stories. Also collaborate with organizations who are, like Diksha. I'm not trying to sell that flag, just saying organizations who are working with adolescents on sexual and reproductive health education, health and rights education, because information and the value of consent, you have to integrate these two things very strongly with whatever health services you're taking to the community for the overall health of women, adolescent girls and women, to improve and to actually allow them to emerge as change makers. They can be. You just need to give that little push. Thank you.
Thank you so much. So we would go to Ms. Preetha. Women constitutes half of the population, but stories about women, for women, by women is very rare and very scarce. So how do you see Kathakars playing an important role as storytellers in communities of Sundarbans?
I think I'll just take it up from your whatever you said. Like that is one of the key thing. Like recently we have faced in Kumirmari, our Kathakar Prabha. She was going around and asking different women about menstruation and the hygiene related to that and all these things. And most of the women they felt very embarrassed and they didn't want to talk about it. And Prabha was, after a point, she was almost like helpless, coming back to me like, Didi, no one wants to talk about this. And what I feel is why it is important, one woman to ask the question in the first place. Because while Prabha is going to, from door to door and asking different women about their, menstruation, the hygiene and all this stuff, though they are not, answering it right now, but I am definite, after certain times, because Prabha is not an outsider. It's not me who's going to Kumirmari and asking them these questions. And Prabha is someone also, at times, she was asking someone, one of the lady, are you using clothes during menstruation, you're using pad? And the woman was like, what kind of question you're asking? Stop it, kind of thing. And then she was almost scolding, I know you are using clothes, you should use pad. So I'm just saying, when you empower a woman to ask the right kind of question to other women even, so there are many taboo subjects, at least that will make them think. So today they are not speaking, maybe tomorrow they will go and speak about it. So I think women are, I really believe, they're great storytellers. That is, as you very beautifully explained, how our grandmother used to be the best storyteller in our life. And also, I will say, from the villages of West Bengal also, the women used to actually stitch on clothes different stories. So the storytelling has been, so much part of our culture also over the years from women's perspective. So they kind of inherent that quality, how they I think they kind of interact more from a very empathetic lens. But at Rekanta, what we are trying to do, it's not only about capturing very random stories, but it is also, we are making them aware of the reality and making them asking the right kind of question, which will create in other way awareness among different other women also. So we have so far many sad stories also captured from different parts of Sundarban, as I think many of the women still do get married at a very early age. We have documents of many women, telling how they wanted to become someone else, but they, end up being, married at a very early age. So I feel these are the stories, it's not something I haven't heard sitting over in Kolkata. I had more or less an idea, women do get married at a very early stage and this and that, but those were more in a data form for me. So I didn't have any human association with those stories. But after coming in Sundarban, working with Prabha, Sheba and all these very powerful ladies from all these islands, and when they started capturing these stories, and then each and every story becomes this individual story, which kind of, right now also I'm getting goosebumps, because you get to know them in person. Suddenly you start connecting more with them in an individual level, not in a very generic data level. So I think that is one of the very important factor, that we need more community storytellers who will come with these authentic stories, which will connect not it is happening actually both ways. One is they are asking the right kind of question within the community, and they are creating certain awareness. At least I think for any kind of change to happen, the first step is being aware there is a problem. So that's what they are doing in the first place. And for the outsiders, I think they are giving names to those datas. giving stories to those data. And it becomes like, I think all the guests over here, they have been closely working with communities and they know probably what I mean. Like, once you connect with each and every one of them in an individual level, in a human level, I think the passion becomes even, tenfold more. I think, yeah.
Thank you so much, Preetha. So, as you said about stories, so we would go back to Pompey. Pompey, as we have been working with Merck for Mothers in one of the aspirational districts in Jharkhand. And as you know that women as a community health workers over there, they are working with the frontline health workers, with the ANMs and the ASHAs. And we are also seeing a significant change in terms of health-seeking behavior, in terms of nutritional patterns. So how do we take this journey ahead? How do we create impact at scale through these frontline health workers, and how the PPP, the public-private partnership, can play a greater role towards this impact?
Tirumala, thanks for the question. Again, my belief is really to kind of ensure sustainability from the start and kind of have an exit plan if there is funding available. There is no harm in collecting small amounts, even small amounts that women can pay, say if it's 5 rupees, 10 rupees a month, because then there is ownership and then there is skin in the game, and they would come and kind of, I think the results are very impressive in terms of the knowledge and skills the workers have gained, the referral patterns, the identification of high-risk cases. However, I think this is something, what we funded was really government's responsibility in terms of delivering a package of care to the women. If the government does not step forward and include it in their budget going forward, I think one will have to look at private sector ways, and that is to kind of, based on the ability to pay, on a decreasing subsidy, start collecting from women. And I think that will form kind of a mutual, understanding between the women, and that ownership, and maybe going forward, the women will start to lead such community-based schemes on their own. We've seen this work across, especially where governments fail. The community ownership will come in, but I think, what you said about, asking the right questions, for women to understand the need for healthcare and how it's benefiting them, sharing all the insights that you are gaining, not like the presentations that we see in our office, but insights that matter to them, and really tell them that, these are the women from your community who have been saved, or who possibly could have had a stillbirth. I think those are the stories that need to go back. It's kind of a two-way process. Like in healthcare, we talk about follow-up in primary care, which is lacking. Look at the maternal mortality indices. Why are they going down, whether it's in the United States or in good states like Kerala, is because of the postpartum care, which is very often neglected, and women feel that they are, they have gotten over it, and not just, physically, but even mental symptoms that are kind of almost killing women now. So I think, healthcare is something that one has to understand is requires to be delivered continuously. It's a continuum approach, life cycle approach, and it only needs to be strengthened everywhere. And the more ownership you give to the communities, the more finance you inject into it, the more healthier the system will be.
Thank you so much, Ms. Pompey. So I would take that keyword from you, microfinancing. So I would go to Ms. Paramita. As you spoke about gender equality, about the disparity that exists related to sexual reproductive health, if you want to see the revenues, the sources of revenues that we could generate, at least in this field of sexual health, what it could be, how could a microfinancing scheme could be a sustainable approach for this, reproductive and health issues?
Thank you for the question. It actually allows me to talk about something that we've been trying. But before that, can I take 2 minutes to share just one small incident? Because I mean, I had tears in my eyes when this happened. This is just 3 days back. I was in a different workshop with a group of 14 girls and boys from a rag picking community. They are emerging community leaders. It's just a simple thing. I just asked one of the girls that, please pull that chair for me. And a boy in that room said, no, not her, auntie. She has her periods. I'll pull it for you. I cannot tell you why I had, at least probably the Indians here will know what I mean. To hear a 15-year-old boy say this out loud in front of quote-unquote adults. That is the change that we are probably dreaming of. And that is what SRHR education can do. So, since menstrual hygiene is one of the key taboos, and that will at one level feel the least resistance, because you're not talking sex, quote unquote. Maximum resistance from adults is that you can't talk sex to adolescents, then they will become sexually active. So, menstrual hygiene is one route of entering with, and that's why I said you allow me to talk about something. We are trying out a program which is so far, we're doing it in 3 villages in 2 districts right now, and it is proving to be successful. Simple. We're sourcing unpacked sanitary napkins from the producers directly. The women are packaging them in transparent plastic and selling them door to door at a price,
that these people have in their hand. And I think all of us must have noticed after coming to Sundarban, like I think in terms of entertainment and all, like each and every, not only youngsters, but also like the elderly people, I have seen everyone is kind of glued to their phone. The only thing we require to do is to make them understand that they can use it differently also. They can pick it up, they can switch on their camera, they can ask the right kind of question, they can document their own life stories. And that kind of changed a lot of things. I will tell you a very small incident which happened last year. So there's this, during October, suddenly there's this cyclone happened. So most of the time, the journalists, they do reach from Kolkata to Sundarban on the next day when everything has already happened, and somehow they manage to get some video footages of the cyclone and stuff. So they will keep on repeating those footages on television, and they will interpret everyone as a victim, and they will look through a lens of very much like pity towards them, and that's it. So that's once in a year we get to know about Sundarban. And apart from that, if there are like few tiger attacks, so maybe it will get like on the 5th or 6th page some small mention of Sundarban like that. For the rest of the year, we conveniently forget about these people. But last year, what happened, like the day the cyclone was hitting Sundarban, Prabha, our Kathakar from Kumirmari, she went out and she started documenting this whole process from her own, like, because her pond was getting, flooded with saline water. Her husband has taken a loan of 2.5 lakhs. He couldn't pay that. That's why he had to migrate to Kerala to work as a migrant laborer to earn back that money. And whatever money she has put last year in that pond, that was getting flooded on that particular time. So she was standing there and documenting herself. And she said, like, right, like yesterday the water has come till this point, and today if it comes little more, it's going to enter my pond and my fishes are going to die. I don't know what to do. So this is the power of stories. Like, no journalist will ever be able to capture it. First of all, the timing would never match, and second of all, like, what a person is going through while she is documenting her life, no one, I mean, any great filmmaker also can't come down there and interpret it in the similar way, the way she has done it. So I think that's the power of the technology, the smartphone, and we just need to empower them to use it differently, to frame it differently. So yeah, thank you.
Thank you so much. So I have a common question to all of you on the panel. So from here, from Unconference, where are we heading forward? Pompey, please, you can start.
I think if you really see, all this talk about, women empowerment and women becoming custodians has a lot of merit in it. Women have proven to be better custodians of finances. They just need to be empowered. So I think, going forward, ensure that these models have some, contributions and more ownership and accountability built in. So whether it's even if it's for the government, I think we need to ensure that the government is accountable. It's not just walking away with some, good pictures and saying women in my constituency have got X, Y, Z. And I think only the women can hold everyone accountable.
Thank you so much.
So my suggestion would be that now that you have actually reached out to the people who are living here, there is a bridge. Connect up with the adolescents, and I think for women to emerge as change agents, we need adolescent girls and boys to work together. Not away. That's where gender relations transform in working together as equal partners in change. So even as you were addressing the health needs of women, start building earlier, building groups. Collectivizing adolescent girls and boys, because they will actually speed up this change. That's been my learning. So that's the action point, and I would love to be associated with that, because I think that's one area where I have some expertise, some little expertise. Thank you.
Thank you.
As I just, I think briefly touched upon it in my previous little talk. I think the first thing is, let the women speak for themselves and raise the expectations. When you see a woman, don't kind of like they typecast Preetha very politely that are you going to make films? That should never have, that question shouldn't arise in anybody's mind. It is natural and normal that she's going to get married, and after that she will come back bigger and stronger. When she has children, she will obviously have a different perspective and she will make better films if she wants to. That is her choice. So the first thing is change the expectations from women, especially Indian women. Don't typecast a woman. This is their job, and finish, and don't give them support. So if you really want to bring about change, there is a huge role that we all have to play here. Is number one is increase expectations and also give them support. Support doesn't always mean that you have to support them financially or something. You have to learn how to enable women to do things. And enabling a person by standing back, it is not very easy. It has taken me decades before I stopped interfering in the affairs of a woman. Honestly speaking, it's a lot of practice. It is not very easy. And I really thank people in the Western world who have actually taught me how to do this, how to enable a woman, how to actually listen to a woman. Though you may sometimes think that she's not right, she's not actually speaking what your mind wants them to speak. But the women always come with a different perspective, and we must learn to be patient and sometimes let them work. Even if it hurts your ego, bad luck, sometimes you must understand that the women may be right and you must be wrong. So it's not very easy, and it takes a lot of practice before you can start talking to a woman. Yeah, thanks. Preetha is so happy. Okay, yeah, that's good. It's not easy.
So in Vedanta, we are just technically 1.5 years, but mostly like 1 year old. We are taking baby steps now, but we really believe with the cause we are working on this model, the storyteller, community storytellers telling their own stories. And going forward, we would like to see more women Kathakar are coming and joining us. As of now, I think one of the biggest hurdles which we are facing is this is such a new concept. So it's very difficult to make a community people understand, like, how important it is to kind of give voice to their own opinions and their stories. So that is one of the biggest hurdle we are facing, but we would really expect, like, going forward with the help of technology and the model we are working with, that the community becomes like very spontaneously part of it. As of now, there are certain hesitance, uncertainty, and kind of, they are very unsure of what is happening. But we would make sure that, we deal this whole thing with much more respect, and we have many, many more Kathakas with their stories, joining us in our platform.
Thank you so much. And that brings us to the end of the session. And if you have any questions from the audience, please.
Thank you. That was a very thank you. That was excellent. I mean, like, the four things that I sort of take away from the discussion, broadly, one is like, Pompey, you were talking about sort of the inclusive business models which need to be put in place, especially those which are slightly more isolated areas like Sundarbans, and that can sort of help for them to see the value of what they get and also give it. And so unless that value is seen, they will not be able to or willing to pay for the services. I mean, that's whether it's a health services or any other services, it's applicable. And so how do we sort of bring in the inclusive business models or the approaches into our work? It could be something that we can discuss in the next 2 days. The second thing that sort of stands out, Paramita, you're so good, is that it's just not, you're not talking about just inclusion of the women. I mean, as an agents of change, you're talking about more of a transformative kind of an approach, where the very example that you gave, that when the boy said that, I am going to remove the chair and not the girl because she's having the periods, that speaks a volume for, this kind of transformative kind of an approach. Time and again, we are talking about the culture, we are talking about the local ethos and factors, and so therefore localization of the solutions is very, very critical. Whether it's a localization of local solutions, how do we sort of add the global values is something which is very critical. And Preeta, thank you. We have heard about data analytics and data visualization, but the humanization of data that you talked about makes a tremendous impact when it actually comes to, making your work visible and also making your work sort of impactful. The question that I have, all of you are experts in your areas. I'm just being selfish. Tomorrow morning I have a session. So, and my topic is climate change. So my question is, if you were to talk about a few things that you would like to focus in the context of climate change, okay? How could women in Sundarbans play a more active role as the agent of change? What would that be for the improvement of the quality of life here? Obviously health is definitely part of it, but I'm saying in more holistic way, these are broad things that we can try in many places, but in Sundarban, in the context of climate change, what are those few specific things that you can suggest that you would like to sort of focus on? I hope I'm not being too tricky.
It's a fantastic question.
Livelihood, which is very common over here, is shrimp cultivation. So every day for 5 to 6 hours, they spend inside the saline water. That is kind of, that is making them have a lot of skin diseases. Also, they are having a lot of problems for their, reproductive organs and menstruation problem and all these things. So if we just take up this story, I feel like, they need the solution for this is they need an alternative livelihood. What will get them an alternative livelihood? Most of the women, they are married around 12, 13, 14, 16 years old. I have actually 3 or 4 interviews of women who got married at the age of 12. So what can be an alternative livelihood for them who has got married and then gave birth to a child at such a tender age? They need education. We have to ensure that these children, they are going to school. They miss most of, like, and that's not only for Sundarban, for many other places also. As being a documentary filmmaker, I have interacted with many other communities in India also, like marginalized community, if you call them so. So there also the similar problem happened, like the girl tend to miss their school because during periods, and that is because they don't have a washroom in the school. So I really don't know, like, if I can pick 3-4 key points over here, because everything is kind of interlinked. And as far as like climate change is concerned, as you said, like, that is something beyond our control, and probably much more bigger people has to, decide, and not the people of Sundarban. They can't, they are just trying to survive the whole effect, which is probably created by other, big heads.
The question that the answer is really in localization. So there are solutions that work for kind of, Sundarban kind of scenario. I have seen Orissa for over 2 decades now. And now in all the cyclone hit locations, you have these, houses which are constructed at a height, and they are very eco-friendly. So there are solutions. They need to be implemented locally. And that's where the global best, solutions can be brought to bear. So it's very strategic, but these need to be scaled. So in Orissa, they could save lives only when they ensure their entire coastline had those houses. And so every time there is a cyclone warning, everyone goes up and there is no death, right? So when there are such solutions, of course, Sundarbans will require some other sort of solutions. And similarly, even with healthcare, it just starts with a solution that's implemented at a local level, iterated, and then, that's how the solutions will evolve.
Do we have any question? কারো কোনো প্রশ্ন থাকলে আপনারা বলতে পারেন, কারো কোনো গল্প থাকলে আমাদের সাথে শেয়ার করতে পারেন, শোনাতে পারেন। কেউ কিছু বলতে চান? Please.
I got a question. I'm very interested in this concept of the kathakas, the storytellers. I was just curious, how do you mobilize them? Then how are the stories released? What platforms? And then what is particularly, why are women great agents for this? Is that sort of a historical, traditional thing that women are kathakas? And this is fascinating to me.
So yeah, how do first of all, like, as I said, probably I'm also gender biased. That's why I said, like, women are great storytellers. I really do believe in, because all our grandmothers, I think you have also faced a similar. They generally tell great stories to us. So I think women are more empathetic and they are more observant in general sense. We just feel, but we started actually working in Sundarban. Then we are now also working in Hyderabad. For this model to work, I think what we are looking at is not as of now, we are not hiring anyone as a full-time employee. So for women, generally in such communities, they are the people who take care of their families, and they can't give you full-time. And whatever time they have, like, apart from doing the household jobs, those are the times they actually use for being a kathakar. And and you asked, like, how do we mobilize?
Yeah, like
them?
how does the actual stories get recorded? Do you give them cell phones, or is it?
Yeah. So what they do is generally like, maybe we give them some bigger topic. Like, this week we will follow some stories on, health of your community. So can you go and get stories and talk to your community members and, get some, like what are the kind of problems they have faced? What, what is their actual occupation? Like that helps us to understand, like, why probably certain things are happening to them, or maybe if some local festivals are happening, so we will just ask them to like go and kind of record that. We also ask them to go and talk to the fishermen, as I was talking to, I think, Shomitroda in the morning, that most of the young men from Sundarbans right now, they are going out of Sundarbans as migrant laborers. So the current generation, if you ask any middle-aged men over here, they would say like the young generation is not at all interested in our kind of work, which is going to forest to collect honey or for fishing and stuff like that. So if each and every occupation, they have certain kind of tradition and science also rooted in that. And because the young generation is no more interested, so those like after this generation they passes away, those all knowledge will be gone along with them also. So we are also trying to document those culture and history and the knowledge, the immense knowledge this community people have. So these are the kind of, like, we are not focusing in any particular thing in Sundarban as of now, but we have some larger things, so around which they are shooting their stories and their daily lives. Also, especially I keep on mentioning about Prabha because she is very, as a Kathaka, very close to all of us. Last year she has gone through a lot personally, so we also encouraged her to document her own journey. So as I say, her husband took some loan and to cultivate fish in their pond, and then suddenly Amphan cyclone happened in 2021, and the whole fish were but they were completely gone. So after that, her husband had to actually migrate as a migrant laborer to pay back that loan, and again he took some loan to cultivate last year. And this is the first time actually he left as a migrant laborer, leaving Prabha's 4 years old son and Prabha alone in the village. And then we encouraged her to document her life actually during that time, because this is the story of not only Prabha but most of the women in Sundarban Islands, how they cope up with their life. And I don't think we have anything that sort of stories in any platform outside. And lastly, to the platform you're mentioning about, we also want to actually make this platform which will be led by the community members and for the communities also. And our vision is actually not only within Sundarban, we have already working with Hyderabad community also along with TOD and iCure. So we want all these communities all over the world, they have this democratic platform where they can share their own stories and they can exchange the knowledge they have with each other. So that's our vision actually.
Yeah, adding to that, in terms of the platform right now, let's say they are on YouTube, but Recounter would be having its own technology platform wherein these videos would be available, and which is not possible in YouTube. Let's say if you want to search on very specific key criteria, that I want to see a film or a story which is, let's say, about Sundarbans or any particular island with a particular mood, with a particular theme, with different hashtags. So you'd be able to get content very, very specific. And as we speak, I think the amount of content that Recounter has produced just for Sundarbans is actually more than YouTube. Can you believe that? So I think in terms of the hashtags, tagging, mapping, that would be made available so that any person who is specifically looking for very specific content, they can deep dive. And the plan is also to create on-demand content, meaning that some of the contents may not be available, but if you want to visit a particular place and you want to see before you are actually visiting, that can be also done. Thank you. And we all get to watch some films tomorrow night, I think. So.
Yeah, we'll be watching few of the films created by our
Right.
Kathakars, and we'll be meeting this powerful Kathakar Prabha also over here. I'm really proud that she can make it tomorrow. She'll be coming down all the way from Kuminmari to be with us.
I thank all of you, all the panelists, for the lovely session. It was really inspiring, and we are really motivated to take this journey forward. And from here, it's only forward, so that together we can, we will, and we become agents of change. Thank you all.
Thank you.